My name is Morgan Harrington, and I am the National Coordinator of Programs here at the American Liver Foundation. I'd like to be the first to thank you for joining us today for our Biliary Atresia event. While BA Day was officially on December 1st, we are grateful you are all here to join us this evening. Our event today will be recorded and later shared on our YouTube channel. So if you are not comfortable being recorded, please feel free to turn your camera off now. Today's event is being delivered on the Zoom platform, and as mentioned, will be recorded. We would really appreciate it if you could mute yourself during the presentations to avoid any disruptions to our speakers. If you have something you'd like to say or you have a question, please feel free to use the Zoom chat or the raise your hand feature. Once we are completed with our event today, we will have a Q&A portion where you can unmute and ask questions directly. I am excited to share that today we are joined by Dr. Vania Kasper of Hasbro Children's at Brown University. She will be sharing valuable information about pediatric nutrition and BA. Dr. Kasper is an associate professor of pediatrics and a clinician educator. She serves as the director of the Center for Pediatric Liver and Pancreas Disorders, the Pediatric Cystic Fibrosis Center, and the medical director of the Division of Pediatric Gastroenterology, Nutrition, and Liver Diseases. We are also joined this evening by a fantastic panel of families who have diverse experiences with biliary atresia. And we also have two special guests on our panel this evening from Cincinnati Children's Hospital, Dr. William Balistreri and Dr. Amy Taylor. If you haven't already, please join our Life with Pediatric Liver Disease Facebook group for continued support and community. Before we hear from Dr. Kasper and our panelists, I want to share our Biliary Atresia animated video. This has been a great addition to our Pediatric Info Center on liverfoundation.org, but can also be located on our YouTube channel.
Hi, my name is Maya, and I'm here to tell you about my liver. We all have organs inside our bodies, like the heart that pumps blood, the lungs which pump air, and the liver that helps digest food and protect us from germs. The liver is located on the right side just above your tummy. It's like a little factory that helps us stay healthy and strong. When you're a kid, the liver is about the size of an apple. But by the time you're a grown-up, it's your largest organ and about the size of a football. My parents told me that when I was a baby, the doctor discovered that my liver wasn't working like it was supposed to. They said this was called biliary atresia, or BA for short. BA is a rare liver disease that only affects newborns. My liver was blocked and I couldn't digest food. This caused my skin and eyes to turn yellow. I was sleeping more than normal, and my stomach was very upset. Ugh! There is no cure for BA, but thankfully, in my case, I was able to have a special surgery to unblock my liver so that it could connect to my tummy and other organs. Everyone was so happy that my liver procedure was a success. After the surgery, my parents made sure I ate a healthy diet. And as I got older, I began taking vitamins with my meals. The healthier I eat and drink, the easier it is for my liver to keep me strong. I still have liver checkups often. And one day, I might even need a new liver. But so far, so good. Now I'm strong enough to do all the things my friends can do. For more information about biliary atresia, go to liverfoundation.org.
Okay, Dr. Kasper, I am going to go ahead and hand off to you to get us started.
I'd like to say hello and thank you very much. I'm here from Rhode Island and talking today. Thank you to the American Liver Foundation for asking me to give this talk. And I'm excited to hear the family presentations and discussion afterwards. So moving on here, for some of the people in the audience who may be family members there we go, who may not be familiar with biliary atresia, just 2 slides. This is a picture of a healthy infant, and what you can see here is the bile ducts that are in the liver here, and these arrows represent normal flow of bile through the bile ducts in the liver, which then goes into the small intestine and helps us digest foods. So in biliary atresia, the part of these bile ducts that is outside of the liver becomes diseased and can close down, and the bile acids you can see from the arrows are no longer able to go down into the intestines to help us with digestion and absorption. So why is this a problem? As I mentioned, the liver makes the bile, but it can't leave the liver. The bile that builds up in the liver can cause damage in the liver and scar tissue. And then these bile acids under normal circumstances help us to break down fats so that we can absorb them. So we have what's called fat malabsorption, where the fat is actually lost in the stool. And there are vitamins that need to be absorbed with the fat, so these are also lost. So these are the topics that I'll be discussing today, starting with why are children with biliary atresia or BA at risk for nutritional deficiencies. And really this is falls under several different categories. So sometimes kids aren't eating enough. Sometimes they definitely have an increased need for calories, and then the poor absorption. So looking at these in a little bit more detail, why might someone not be eating enough? With biliary atresia, sometimes our motility or the movements of muscles in our intestines that move things through the GI tract are slowed down. So things just move through at a slower pace. In particular, if the stomach is affected, we can have what's called delayed gastric emptying, where food just doesn't empty out of the stomach, makes us feel full and not hungry, and maybe even cause vomiting in some cases. As liver disease progresses over time, your liver and your spleen may become enlarged, what we call organomegaly, and those bigger organs take up space in the belly, which then can also make you feel a little bit less hungry. Additionally, in later liver disease, more advanced liver disease, you have fluid in the belly that can build up called ascites, and that also has effects of just making you feel less hungry and sometimes while pushing on the stomach. With we'll get into a little bit of different minerals and vitamins that are malabsorbed or not absorbed in advanced liver disease. Sometimes magnesium can, if we aren't absorbing magnesium, that can alter our sense of taste. And different medications may have side effects, making us nauseous where we don't want to eat, or also can affect the way we taste food, so it just doesn't feel like we want to eat. And then, of course, the doctors will at times tell you that your child can't eat, or the child can't eat because of different tests and procedures. If anesthesia is needed, we need to make sure that they don't have food for a particular period of time beforehand. So all of these things can lead to less intake. And then our body, because of the demand of dealing with the inflammation that can be in the liver and the bile ducts, requires more energy. So we estimate about 130% or 150% of what an average child without biliary atresia would need. And the liver, under normal circumstances, stores energy and sugars in the liver that we can use during times when we're not eating. So for example, overnight while we're sleeping, or if there's an extended period of time where we're not eating. And then the body, instead of having these stores in a liver, will use protein or fat for energy. And that is just using up more calories that we we would normally have. And then, as I mentioned, we have some increased losses. So we lose extra fats in the stool from malabsorption, and we develop, or people can develop, fat-soluble vitamin deficiencies. There are vitamins that are needed, need to be absorbed with fat, and so if we're malabsorbing the fat, we're going to be malabsorbing the vitamins. So moving on to the next topic, how do we assess nutrition status? What do we look at? These are pictures of typical growth charts, which may be helpful, and we usually do look at these when children come into our clinic. Over time, they have some limitations in people with liver disease because of the fact that they don't account for muscle mass, they don't account for large organs, so it's not telling us, and if you have a lot of fluid in the belly, it's not telling us your nutrition status, it's telling us about fluid and organ size. On the left side, we have the chart that we use in, an example of the chart that we use in children under 2, and then on the right, children over 2. So this is something we definitely still use, but does have some limitations. One thing that is a little bit easier to track is either the mid-upper arm circumference or a tricep skin fold. And so these are measurements that we take at the arm, and there are standard values that we can use to assess nutrition status. We measure the arm from the shoulder to the elbow, pick the halfway point, and then measure the circumference around there. And we can track that over several visits to see if there is good weight gain and if the child is falling within our goals for nutrition for that individual. It's important to note that there are many equations that exist that give us a starting point for nutrition, but there are no predictive equations available in biliary atresia. This example that I have a picture of here is something called indirect calorimetry, where the person is asked to stay very still. They wear a helmet and they can't move for a period of time. It's about half an hour to an hour. And they measure the gases that you're breathing are measured to make an assessment of exactly how many calories you need. And this is obviously something that isn't going to work for most children and certainly for babies. So how do we provide nutrition when we decide that someone needs more nutrition? And certainly our first, second, third effort is to have children eat by mouth. We call this PO, or per os, and this is what we call an enteral form of nutrition. Enteral refers to nutrition that's being delivered into the gut or into the belly, and this is definitely our preferred mode of having kids receive nutrition. If kids are not able to get enough nutrition through just eating alone, we have an option of something called an NG tube, which is nasogastric. So you can see in this image on the left, the tube is entering through the nose, goes down through the esophagus and into the stomach. And the child on the right is receiving a feed through a syringe, so you can push formula through down into the stomach and help to boost nutrition that way. So we call this an NG tube, and this is also enteral because you are using the gut. G-tubes are less commonly used in children who are pre-transplant, but they can be used. So G-tubes, in the right-hand side, you can see a picture of the stomach and the abdominal wall with the tube going from the outside into the inside. And this allows us to give nutrition without having a tube through the nose. It's also enteral, rarely used pre-transplant just because we want to avoid gastric or stomach surgeries as much as possible. And also if a child has the extra fluid or ascites or has veins around the stomach, sometimes that can complicate placement. They can also be used post-transplant, and definitely they can be placed during a transplant surgery if needed. And the last form is total parenteral nutrition. So this is the only one that is not using the gut directly. In the image on the right, the man has a catheter or a large IV going in through his chest into those vessels in the chest. And through this, the image on the left has our banana bag, the yellow bag that contains all the sugars and proteins that we need. And then the white substances are the fats that we need. And this can also be supplemented, or is also supplemented with minerals and vitamins as needed. So what are some common nutrition recommendations that we'll make before transplant? And this, I wanted to just kind of step back a little bit and explain the difference between different types of fat. So there are many different a few different types of fat. And one of the big ones that we focus on is medium chain versus long chain fats. So in this image, we have bile acids represented by the little stars, and long chain fats come down through the intestines, and the purple circle here represents one of the cells lining our intestine. So these long chain fats are broken down by the bile acids. So you need bile acids in the intestines to process them. They're then absorbed into the intestinal cell, reassembled, and then transported into the lymphatic system, which is a system in our body that transports fats. It is then from that system transported into the portal vein, which then goes to our liver. So this is a multi-step process and is bile acid dependent. However, there are also a different kind of fats called medium chain, and these passively go through into the intestinal cells and then are moved into the portal vein, or the blood circulation that goes to our liver. So it does not require the bile acids and is a much more direct process. So we will frequently talk about trying to increase the amount of medium chain, or MCT, medium chain triglycerides, and we focus a lot on trying to optimize that. So we do that with different kinds of formulas. There are specific formulas that have a larger amount of MCT. And then for infants who are breastfeeding, we can supplement with MCT oils, where you're just getting a little bit of the fat in those oils. The problem with these is that they don't always taste good, and sometimes it takes a little while to have a baby adjust to the formula, adjust to the oil, and so it does take a little tweaking sometimes in order to optimize this. Another important note about fats is the essential fatty acids, so linoleic and linolenic acids. These are present in most formulas, and if a child is on TPN, we make sure that these are in TPN, but these also can be malabsorbed, since you are just malabsorbing fats in general, and so this is something that we may want to supplement and monitor in a pre-transplant patient. Protein historically was restricted in certain situations because of a concern of it worsening something called hepatic encephalopathy, or kind of changes in the way that our brain is functioning. But really, we've moved away from that at this point, and we don't recommend any protein restriction. There may be very rare exceptions where that is changed, but for the general rule, we want protein. And this is because sarcopenia, which is loss of muscle mass, is associated with poorer outcomes, both pre and post-transplant. And so we want to make sure that your body has enough protein to keep up the muscle as much as we can. And I've mentioned fat-soluble vitamins. So those are vitamin A, D, E, and K. These are often supplemented with a single DECAs or MVW with maybe some additional on top. So if you really need a lot more vitamin D, we'll give you a DECAs and extra vitamin D. Why are they important? Well, deficiency in A is associated with blindness and immune deficiency. Vitamin D is associated, deficiency is associated with bone weakness, pain, and muscle weakness. E is associated with nerve and muscle damage and immune deficiencies. And vitamin K has an increased risk in bleeding. Other elements can also be malabsorbed, so there's a lot of attention put on labs and blood tests to look at these things. So water-soluble vitamins, calcium, phosphorus, magnesium, zinc, selenium, and iron, and may be supplemented individually. So we are looking, and when we start a nutrition assessment, we're looking at regular diet for a child of that age. We boost that, like I said, to about 130 to 150% of the initial value. And then we have you come back and we reassess in a couple of weeks. For infants, if you're not meeting the goals that we're hoping for, we'll boost the calories in another way. So either usually increase the number of calories per ounce in the breast milk or formula. We'll talk about whether we need to feed smaller amounts more frequently so that we can ultimately get more in within a 24-hour period. And then we reassess. For older children, boost calories with bigger portions, bedtime snacks or formula snacks. Feed smaller. Sometimes people do, instead of bigger portions, smaller amounts more frequently, and then bring you back and reassess. If still not meeting goals, then we start talking about an NG tube, where we can do overnight feeds or do continuous feeds. And then it's always a process of reassessment and moving on. So ultimately, this is a big circle where we're having you do a recall of what you did for the last 24 hours, applying our estimates, looking at data, growth charts, our MUAC, recommended changes, and having you come back. So lastly, I just wanted to spend a couple minutes talking about what are some things you may hear after a transplant. And really the focus is healthy diet for a healthy weight. Different recommendations for different people, depending on any dietary restrictions you may have, vegetarian or something else. But overall, it's whole foods and a limitation of processed foods. So if you open your package of food and it has silver on the inside, it's probably a processed food and would be one of the things that we don't want you having on a regular basis. We, after transplant, ask you to avoid water from lakes and rivers, avoid unpasteurized dairy products, no raw or undercooked eggs, meat, and fish. So for all of those 3-year-olds who are eating steak tartare and sushi, we're going to ask you to limit those or avoid those. And then, of course, you know, certainly my children hated grapefruit, so this would never have been an issue, but grapefruit does interact with some of our immune suppression medicines and is off the table. I just wanted to put in a plug here for the fact that sugar, there's a huge amount of sugar in our diet these days. Fructose is a form of sugar and it is a component in high fructose corn syrup. This is processed differently by our liver and does increase our fat deposition within the liver. So fat can be irritating if it builds up in the liver and cause inflammation and more damage. Also, there is evidence that it leads to bacteria moving from the gut into the liver, and it's addictive. So there are studies showing that rats who are addicted to cocaine, if put in a cage, will choose cocaine or sugar over cocaine and sugar addicted rats given naloxone, which blocks our opioid receptors, actually have withdrawal symptoms. So physical withdrawal from sugar. And they have actually coined this fructoholism. So a plug for where to go to learn more would be our American Liver Foundation has a site with examples of healthy meals and easy diet recipes. This is an example of those with options for breakfast, lunch, dinner, and snacks. And that is it.
Thank you so much for that. It was absolutely wonderful, and I appreciate sharing our 30-day menu. I'm also going to drop some of our favorite kid-friendly recipes into our chat as we continue, so keep an eye out for those. Before I ask some questions for Dr. Kasper, does anyone have any questions currently that they would like to bring to her, or any thoughts or comments? Okay, so we have some questions that we've pulled from our pediatric Facebook group for tonight. So you mentioned several things about nutrition and obviously meeting with providers and going through with their physicians and discussing, where maybe we need to increase some different nutrients that are in there. But what other supports can patients receive or their families receive in order to improve nutrition throughout their illness or early stages of disease?
I think that every center has a different support system, but the dietitians are really valuable and essential part of the team. And I think it's very important. There are a lot of resources online for patients and families, and I would only caution that maybe discussion with the healthcare team or with their dietitian can also help to ensure that those suggestions are safe suggestions to follow through with.
So thinking along those same lines, what role does hydration play in all of this?
Certainly hydration is very important, and it's important for our kidneys, which although we focus so much on the liver pre-transplant and post-transplant, the kidneys are essential and valuable. But there can be times if liver disease is very advanced and there is a buildup of fluid or ascites that we have to put some mild restrictions on fluid intake. So being able to monitor a child's hydration status with urine output and tears and things like that is also important.
And then you talked a lot about, being rechecked and really following those nutrition guidelines closely with their providers. But are there any signs or symptoms that would jump out at you that would say maybe these are things parents should be looking out for in between appointments that maybe are indicators of nutritional deficiencies or areas of concern?
I think that watching some nutritional deficiencies will show up as abnormal rashes or in infants, it can be hard to know if they're having vitamin A deficiency or something like that, where they're having issues with sight. But in older children, certainly if they started to complain of difficulties with seeing at night or something like that, sometimes those things are easily written off as, oh, it just wasn't bright enough. But rashes and changes in taste, not eating as much, paying attention to those little things and at least bringing it up to providers when you see them, so that then if there is an area of concern, they can pursue it with you and maybe check some labs.
And then the question that most parents have, aside from the kiddos who are eating that steak tartare and sushi, what are some really highly recommended protein sources for little humans that maybe are having a hard time getting in higher numbers of protein?
So it can be difficult or not. It can be patient dependent, depending on if you have any dietary restrictions. But meats, nuts, legumes, beans, all of those things are really good protein sources in addition to some of the formulas. So in older kids, Pediasure or Ensure can be a really great source of protein as well. Cheeses, dairy.
Yes, I feel like those are usually easy, accessible ones as well.
Yes, easy.
Really,
bring a cheese stick with you.
yes, everywhere. I really appreciate your presentation today and just taking time to be here with us and giving everyone a little bit more insight on what that looks like from you guys' perspective and how parents can best support their kids as well.
Thank you.
We are going to shift over with our panelists now, and we will get started. What I would like to do, and I'm happy to call on people, so it makes it a little easier since I know everyone is set up slightly different on screen. And I would just appreciate if you guys could do a quick introduction, just sort of a little bit about yourself, your story, when your diagnosis was or your child's diagnosis, and sort of your journey until today. So Carly, you are first on my screen, so I am going to put you in the hot seat if you want to go first.
Can you guys hear me okay?
Yeah.
Okay, great. My name's Carly Anderson. I'm in Fishers, Indiana, and I am an American Sign Language interpreter. That's how Morgan and I know each other. I'm also a registered nurse. That came later in my life. Mom of 3 children. I have 2 boys, and my daughter, Zoe, was born with biliary atresia. She's now 7. We found out about her, well, let me just say, when she was born, I had a gut feeling that something wasn't quite right, just based on being a mom of 2 and just gut feeling. I thought her eyes looked gray and that they didn't look like big and white. And so I had a gut feeling that there was something going on, but just kind of brushed all of that aside. I was told, you know, she's fine. We never had any tests or anything right away. Brought it up at her first doctor's appointment with a pediatrician. There was no indication really to have any labs done at that point. But then soon after that, like I would say 6 weeks or so, we started noticing like her stools were turning white and she became jaundice. She wasn't really jaundice at first. And so went back to our pediatrician and ended up getting labs and a scan done. And that night we were at Riley Hospital, in and out. Our whole world flipped upside down pretty much for the whole year leading up until her transplant. So we were in and out of Riley. We also went to Cincy Children's because at that time they were doing living donation with Pediatrics, which I think IU Health in Indiana is now doing that with adult population, but not yet Pediatrics. So we were back and forth between the two. She had her transplant at 13 months and it's a little bumpy right at first, but she's been, knock on wood, very, very healthy girl. We've had 1 hospitalization since, and that was for a GI bug that she had, and she got really dehydrated. So that's Zoe.
Thank you, Carly. Tiffany, you are next on my screen, so I'm going to hop right over to you if you'd like to unmute and share your story.
I'm Tiffany Hicks. I'm from Monroe, Ohio. I had a daughter, but 4 years before Cooper, she passed away from trisomy 18. And then we had Cooper in 2016. I think they caught his direct bilirubin really fast. His pediatrician did. It was like within a week after him being born. So we got transferred to Dayton, and then they transferred us to Cincinnati after his HIDA scan didn't show a gallbladder or anything like that. So we were at Cincinnati Children's. So he had his PSI done 28 days old, but his failed, and he had his transplant. I was his donor at 7 months old. So then the first year was kind of bumpy, of course, but he's been doing really well since then after that first year kind of got over. So he's in 3rd grade. He's 8. Right now he's doing a toy drive for Deliver Kids at Cincinnati Children's. And I think that's about it. So.
Thank you, Tiffany. Taylor, you are next on my screen, so I'm going to pop over to you if you want to unmute and go ahead and introduce yourself. Okay, Taylor, we will come back to you. And oh, did you get
I
it?
think I
We
got
have
it,
you
yeah.
unmuted. I just don't have your camera. There you go. You're
Can
good.
you hear me now? Okay.
Yes.
My name is Taylor. I am from Northeast Missouri. We are about 2.5 hours from the closest major hospital to us, which is Columbia from Mizzou. Walker was born at the end of in October of 21, and he was almost 3 months old before we caught his BA. We'd been in the pediatrician a few times. Actually, not a pediatrician. We don't really have those around here. A family doctor. And they kept saying, put him in the sun, he'll be great. We went to Texas at Christmas and he became more yellow when we got back. We're like, something's not right. So he was about 3 months old before he had his Kasai. And it just rocked our world. Like, you never expect to not have a healthy baby. And we were in and out of the hospital for his first 2 years of life. And he made it through all that fine, and he has bounced back really well, and he just had his 3rd birthday, and we have not been in the hospital for over a year now. So he's just doing a rock star. We're Kasai only.
That is incredible. Thank you, Taylor. Rachel, I'm going to have to you. I'm grateful that you are last on my screen because your story is a little different than everyone else's. So I would love for you to share your story.
Okay, well, my name is Rachel Perez. I'm from Berks County, Pennsylvania, and I'm a liver transplant survivor. I had biliary atresia. I was born with it. They did not know right away, so it took definitely some time. Doctors would say, just put her in sunlight. I was jaundiced. I had everything, all the side effects that come with it. Really wasn't known back in '95 as much. Just wasn't heard of. I had my liver transplant when I was 4 in 1999. So I was 4 years on a waiting list. So they diagnosed me about a year, I would say a year and a half or so, and they did not diagnose me here. That was in Puerto Rico. So they said, oh, she needs transplant, she's not gonna make it. It was just already at that time, just feeling I'm surprised I'm here. Sometimes I just think like, wow, I can't even believe it. But there's a lot I want to do to show others that, it does get better and you can get through this and live a normal life post-transplant.
Your story is so incredible, Rachel, and I know that others that hear and get to see you in the flesh as an adult can bring so much just hope to other people as well. I am going to shift to our 2 guests from Cincinnati Children. I am going to start with Dr. Balistreri. If you want to introduce yourself and maybe tell a little bit about what brought you to pediatric hepatology too.
Well, thank you, and it's a pleasure to be here. Yeah, I am a pediatric hepatologist here at Cincinnati Children's. I have been dealing with patients with biliary atresia for, I know I don't look it, but 50 years. This has been a burr under our saddle for many, many years because we have not yet solved the problem. The problem that Ms. Perez mentioned of early diagnosis still is vexing to us. So clearly that's what got me started. In 1 year at my previous institution, we lost 11 children because of biliary atresia. And that was in the days before liver transplant. So the good news is we've gone from 95% mortality to 95% survival with transplant. But our goal is to figure out a definitive cure. And in the interim, to use the techniques that Dr. Kasper mentioned to keep these children in as good a shape as possible. So thank you for listening.
Dr. Taylor, would you like to go?
I'd love to. Thank you so much for having me. So I'm also at Cincinnati Children's. I went into pediatric hepatology because, number one, I loved working with children and families. But I also, liver disease was the thing that I wanted to read about when I wasn't in the hospital, when I wasn't in medical school. And it was the thing that I wanted to keep learning about. That it seemed there were so many things that we knew, but so many kind of uncharted territories, and wanted to be a part of finding answers for kids and for families. And I think that biliary atresia is one that crosses multiple different aspects. There's the interfaces with the healthcare setting, with primary care providers, with subspecialty providers, and access to care, and just wanting to see how we can do all that we can, right, to give like kids have healthy lives. And just grateful to be here and learn from all of you guys too, and from your experiences.
Thank you, Dr. Taylor. I do have some questions that I would hope that we can kind of collide stories with one another and share experiences so that other people can also sort of relate to that this journey is not linear. You are not alone in your journey. And all of you do share aspects of similarities, even though you are all completely different people with completely different stories and completely different families. One of the things that I think comes to mind for a lot of people are the challenges behind either having a child with BA or, in Rachel's case, growing up as a BA patient. And that is something that is with you forever, whether you're Kasai only or you're a liver transplant. That is part of who you are. That's part of your story. What are some of the most challenging aspects that you all have experienced, whether it's been emotionally or physically or with your other children? I'd be curious if some of you would be willing to share what those challenges are that you guys have faced since you found out, since your diagnosis or since your children's diagnosis. And you guys can unmute as you want. I'm not going to call on you. If you feel you want to share, please go ahead and unmute to share with us.
So I'll say something. That's okay.
Yeah.
Well, it's definitely been a journey. It's never difficult. There's always going to be obstacles. And right now I'm taking immunosuppressants, which of course puts you at high risk for everything and anything. So it definitely, there's always complication that can occur. I do always believe I only had one transplant, and I'm very fortunate. The future, I do think of, can something happen? Can something change? So I'm, this is for a lifetime. And I do get blood work every 3 months. I get seen all the time, and everything has been consistent. And I'm hopeful to maybe, hopefully one day come off the medication. So I'm hopeful for that. But there's, moments where you have, your liver enzymes are high, or so, there's that question as to, why, what can I do better? So it's a learning experience, also health-wise, just make sure you have a great diet. So definitely a lot of things. I feel like I've changed throughout my life just to, be more healthy, and just to show even parents that are that went through this and that are struggling now. Definitely just learning every time. So definitely, yeah.
Thank you, Rachel. Does anyone else want to share maybe a little bit? Yeah, Carly, go ahead.
I can share. I think the challenges that we have now, 6 years post-transplant, are much different than the challenges that we had pre-transplant. So in a lot of families, I think, go through the crisis of just not knowing what's going to happen. Did the Kasai procedure work? Is it going to work? For how long? Just the unknown is a really hard place to be. And then when you have other family members, everybody has a different level of support or transplant center medical care near them. So that's all just extremely stressful. So I would say that we had all of it. There's the emotional, physical, logistical. Then post-transplant, I think that just watching Zoe's level of awareness about her story and what is appropriate to share, kind of following her lead is what we've chosen to do. But she now, as a little young lady, has a lot of anxiety. And I know a lot of this is from this pre-verbal medical trauma. And so just trying to figure out that world with her. And then also, like you talked about being on immune suppression, we look pretty normally now, but it's hard not to let your mind wander to, is this liver, we have labs, we can see what's going on the inside, but there is always a piece of me as her mom that kind of can let my mind spiral into like, could this be more? Is this just, a picky child? Is she, and because she's been really healthy, I think it's been easy to, just, okay, we're going to get past this. This is a bump, but I just have to constantly remind myself not to spiral with my thoughts about her just based on my own trauma from going through everything with her.
And I really appreciate that vulnerability, Carly, because I know you are not alone with that mom sense where you can, it's very easy to go that route and think that way. And especially because you love your kids so much. Did anyone else want to comment on that? We move on.
I was gonna kind of say the same thing, like feel like we're always in that fight or flight mode. They sneeze one time, like kind of out of the ordinary, and you're like, let's pack our bag, get ready to go. And I don't know that will probably ever really go away. And as like Walker's 3 now, like he's a wild child and he has no fear of anything, and I have all the fear in the world, and so that's become a struggle. And then we just didn't have a lot of resources about biliary atresia, especially like when he was first diagnosed, even to now, like people don't know about it. You're the first doctor you go to, they don't mention it, they don't check for it. And so I'm thankful that like we've been healthy for so long, but we're very fortunate. I mean, people that don't get a cot till 3 months usually aren't in this situation.
So. Yeah, absolutely. And I don't know if Dr. Taylor, Dr. Balistreri, even Dr. Kasper, if you have any advice for parents that maybe you heard some of the challenges that they're up against, and I know you guys see this probably often in clinic. Do you have any advice, or what advice do you offer the parents or even patients that come in sort of expressing these moments of anxiousness or concern? Not all at once.
Well, I think I'll start. I think the American Liver Foundation, with spreading information and allowing a gathering place, is certainly helpful, because you hear the families here, you have a very rare disease. Most of the times a pediatrician has never seen another case. So they're looked upon as a one-off, when in fact, all of us sitting on this line know that rare is relative. If you have one child and that one child has biliary atresia, it's 100%. So I think having that community is very, very helpful. And you've done a great job.
Thank you.
I was just going to hear the common thread is that, you guys became experts and advocates, and you have, in times where you were stressed and worried and not getting a lot of sleep and everything. And so, the way that you guys have done that is really inspiring to do that, and the way that you are generous with your story so that other people can hear, so that, other physicians or, primary care physicians can listen and say, oh, I heard about biliary atresia. And, I think just getting the message out together, and I love that, the American Liver Foundation is doing this, is one of the ways that it can become a more talked about condition, where people know about it and those things. But I think, the way that I think about kind of the physician and families is a partnership, right? And so, Morgan, I love that you said, you're not on this journey alone. And I think that's really true. And it's like, how can we all work together for the best of the children and the families, right? And I'm in awe of the things that you guys have gone through and that you're doing, and the way that your kids sound like they're thriving. It's wonderful. And Rachel, that you are too.
So one thing that Taylor, and I know Carly, you had mentioned you had traveled to Cincinnati Children's from Indianapolis. So thinking logistically, you guys have to travel quite far to even have these treatments, or to go see your physician, or to see with your team to manage the care. What are some ways that this has impacted you guys, or some of those concerns in terms of not having access to care? And like both Dr. Taylor and Dr. Balistreri also mentioned, like pediatricians aren't always aware of this disease. This is considered a rare disease, and maybe that isn't something that is on the forefront of their mind when you bring in a child who maybe is experiencing jaundice for longer, or is experiencing those light color stools. So can you just speak a little bit about how that impacted your journey a little bit with that further distance access to care?
I can go ahead and go. We are just always ready to go. I mean, like, and once Walker's only ever been hospitalized for cholangitis. Never say that right, excuse me. And we expect to be there for a week. I mean, so as soon as they call me from daycare and they're like, doesn't really act like he's feeling good, I go home, get the bags ready, pick him up, and we go. And I'm very lucky, very blessed. I have a really good support system here I have an older son who's 6. So I have somebody to keep him and take him to school. My husband works on the road. When we found out Walker was sick, when our family doctor called us and was like, you need to go to Columbia now. Like, they know you're coming. This was January in Missouri. It's not great. My husband works for the railroad. He was in Alabama. And so he comes here. We don't know what we're going to the hospital for. They don't tell you anything. And so and that was like right post COVID. I mean, it was beginning of 22. So everything was just very fresh and it was very high tense. And since then we've had to switch hospitals. Now we go to St. Louis. We started there exactly a year ago. And we went for a pre-transplant evaluation. And we got there and they're like, you're not there yet. You know, his labs are this, his score would be this, like you're not there, slow down. We did want to move his care to St. Louis just to get established there, so that way when that day comes, we're ready. But I mean, we just have to be ready to drop everything in an instant, and our community around us, our support system knows that, and they're ready to do whatever they need to. And I think that is so important, and we're so grateful.
So a little bit more thinking about that support system, I want to transition a little bit to Rachel for a second, because I'm curious, as you transitioned out of being a pediatric into more the adult world, what did that look like for you? What were some things that came up? What challenges did you face with that, or was it easy?
Yeah, it's pretty, I would say, difficult. There's a lot, things I do remember just being in and out of the hospital. It's just something, at the end of the day, this is a mindset. So it's on the mind, and just remembering from time to time things. And as I was diagnosed a month and a half days old, it's just the transportation was even difficult. It was, my mom we were basically living by pagers then. So it was like, oh, we just came home. Oh, now we got to go back. And one time it was a false alarm. So it just was not, it didn't happen that time. The second one did. So that was great. But transition wise, it's definitely different. It's great when you're a kid, it's you just have these great, these memories, and now you're going into adulthood. So, it's just different things that you have to be more independent. Like, oh, I gotta now do my labs, now I gotta do checkups. So you really have to just do your thing now, so that I would say that's the difference in that, but it's been a great transition.
Did you find it was easy to find a hepatologist that was familiar with BA, that was familiar sort of with your case as you transitioned over to them?
Oh yeah, absolutely. I definitely would say I had my liver in St. Christopher's Hospital for Children in Philadelphia, and then went to CHOP, and then on from there now at Penn Medicine. So yeah, it's been definitely great. Yeah, absolutely.
So just before we jump off of you, because I do have your attention, what you've mentioned several times that, taking control of your health is really important, and being mindful of what you eat. And like you mentioned, going and making sure you're following up with your labs and following up with your providers. But what are 1 or 2 things that you might offer to the parents that are sitting with us about helping their kids as they start those transitions, as they start getting older? What are some ways that they can support their kids to be able to be successful as they do transition into that adulthood?
Yeah, I would say definitely always be open, of things will change, especially when they go to school and everything, they may say, hey, I have this scar, so those things will come up. Definitely, I would say explain everything, just be open, honest, everything's going to be well. I had, those concerns myself of, oh, I have this scar, and, even though I'm living a normal life, that it just never goes away. This is very something that's real, and something that, you've all been through. And, it does get better and there will be a great transition.
Thank you. So as a couple of you have mentioned that, like we had talked about, traveling was a little bit of your journey, or maybe you didn't receive a diagnosis early on, or maybe your provider hadn't heard of BA previously, and that presented some challenges. So I'm going to call on Dr. V and Dr. Taylor for this one. But what are some pieces of advice you would offer to parents who maybe are having a hard time receiving a diagnosis, and how to advocate for themselves, even maybe post-diagnosis where they're not being heard or felt like they're not being seen? What are some ways that parents could advocate for their children's care?
I'll start. So I think that it's really difficult, I think, sometimes to engage in the medical system. And I think that, sometimes that can be an understatement, right? But I think that having questions and asking questions is normal. And I think that, getting coalescing that, and then your physician should answer the questions or say, I don't know, if they don't know, right? There's a lot that we know. But I think that what's really important is a transparent, honest relationship, right? Between in a mutual one of trust, right? And I think that's really important, right? We're all, I always will say we're on the same team, right? We're all on the same team, and trying to identify how we work best together. And so I think that kind of, if you're having concerns, bringing those up, but also listening to your voice and what's that. And so I will even tell it sometimes, I think that if you aren't being heard, if you have concerns, if they aren't being, then I think that you are able to, get a second opinion, try to see if there's information. I think information is really important and really valuable. I also think it's our job as physicians to share what we learn and what we know, and to say what we don't know, and have those open and honest communications. Because I think at the end of the day, the most thing that's important is the child or the young adult or the adult in getting the care that they need. And I think that there are more resources now than there were even when I started practicing 7 years ago. And I think that having, patient and family communities and advocacy, and the way that the American Liver Foundation has spotlighted pediatric liver disease is really helpful, and it's really important, and gives patients and families the ability to arm themselves with knowledge to ask questions, paying attention to things that are coming back. And I think that that's great. It makes for excellent teamwork.
Yeah, Amy is always a great teammate of mine, but I'm going to take the other side of the coin, and that is our side as pediatricians, pediatric hepatologists. Communication depends more on reception than on transmission, and we need to educate our primary care doctors, our colleagues, about the yellow alert. If a baby is jaundiced after 2 weeks, you need to work that baby up. You need to listen to the families. So clearly, empowering the parents is a great way to start, but we need to continue to educate. And that's been another 50-year goal.
Yeah, that's a really great point. And it sounds like that might be a great webinar in our future, Dr. B. We can talk about that later. Doing some provider education, because you're right, that is really important, because parents can only get so far without having all of the knowledge, right? And unfortunately, we don't have that information. So it's a really, really great point that you brought up with that. Tiffany, your story is also a little bit unique, as you're the only one that is with us who is a living donor for your child. Can you share a little bit more about what that journey was like for both of you, and some of the challenges that you faced going through that? Oh, you're muted. Sorry.
Got it. I know the whole transplant thing was just a blur. The whole thing was just a blur. So I was expecting his Kasai to work since he was diagnosed so early, which it didn't work for him, fortunately. I know when he was listed in, I believe it was July, and as soon as he was listed, I went and got labs the next day. So I think the testing, it took 3 months. And I remember my last visit, I met with psychologist. I guess they had to evaluate me for that part. I remember just like breaking down how, just everything all together. The testing was a lot. It was a lot of testing. And it was just like a relief that I was able to donate to him that piece, and that he didn't have to, for some reason he didn't get the call beforehand, but he could get that liver while he was still pretty healthy. So I think that was probably about it. So I didn't see him decline like a lot of kids do. Like, he loved to eat when he was little, so he never had a feeding tube. He was very big. I think the only issue he really had was ascites, and he would just get, I think he had probably maybe 3 things of Lasix for it. But I really didn't see him decline like I see like a lot of kids on some of the pages that I follow. So I guess that was kind of a upside of having that surgery scheduled to see that, I guess. So
yeah, it's definitely a unique story, and I appreciate you sharing more of that, because I know that journey, like you mentioned, is not easy emotionally or physically at all for either one of you. Before we start wrapping up, I did want to ask if anyone who isn't on the panel would like to share their story. I do know we have a few other people that have joined us, so I wanted to offer the floor to them to see if anyone felt comfortable either coming on camera or off of mute and sharing their story as well. So I did just want to leave space for that before we continued on. And if not, that's okay as well.
I would like to share, if that's okay.
I would love you to.
This is Adelina.
Hi.
And she was born March 2022. And in May, she had her Kasai procedure. And I think one of the reasons why they didn't catch it as early was because she's a little brown, like my husband. So she has my husband's complexion. So they didn't see the undertone in yellow as much, but her eyes were yellow. Hold on 1 second. And after 2 months of her eyes being yellow, they were like, oh, this is an issue. And then as soon as she had her Kasai, after a couple of months, her skin tone changed colors. So that yellow undertone in her skin went away, and her eyes. And we're just grateful that we have an amazing team. We're in Denver, Colorado. So Children's Hospital in Denver, Colorado is just amazing. And she hasn't had any issues or any hospitalization. So we're extremely grateful for that. And she's a lot. She's 2 years old going on 6. So it's been a lot of fun. Despite the meds and everything, like, she's healthy and happy and full of energy, right, Adelina?
Oh, we're so grateful you have shared her with us. She is really precious.
Thank you.
I'm curious, do you have any questions of things that you have heard for any of the panelists, or things that maybe have resonated with you or sounded similar to your story, or anything that you would like to open with?
I mean, I'm just grateful, like, you guys all share, but just like the community, and you guys have done such a great job bringing experts. So we're just very, very grateful to have a community of experts who are not just passionate, but working really hard to find a cure and keep the lines of communication open.
Thank you for sharing, Destiny. I really do appreciate you being so bold to come up and give us your story. Really do appreciate you sharing your daughter with us as well. So as we start to wrap up a little bit, I would appreciate if everyone would maybe offer 1 or 2 little tidbits of information that maybe you would share with a parent who is either new on this journey, or maybe a parent who is further into the journey, but sort of in maybe a little bit of a road bump with it. So I'm just curious to hear from you all of you, all of our wonderful doctors included, what just a couple of tidbits, maybe a sentence or 2 of thoughts and advice that you would want others to know, or maybe something you wanted to know and you didn't have anyone to share with you. Thanks, Carly.
I can go. I would say that a couple things. For one, I wanted to go back to something that you said about traveling and kind of just the cost that can be wrapped up in not living by a center. And this is tied to some advice too. Take advantage of resources out there. So for example, Children's Organ Transplant Association is an organization dedicated to family support, community fundraising for children in need of transplants, and that money is dedicated to them for a lifetime. And so that can be used towards any transplant related expense. So we did take advantage of CODA because people around us really wanted to support us, and that was the best way at the time. That's what we needed at the time. So take advantage of that type of resource. And this is really hard because I still don't follow this advice, but just somehow finding peace with the unknown, and just little things like when you're a parent and have this crisis and you are watching labs, but you're not a doctor yourself, and you want to partner with the experts because they see the full picture of labs and kind of the trends and the direction things are going. Maybe not necessarily like pediatrician, like we talked about, they might not have all that specialized knowledge, but once you get to the point where you're with the experts, it's really hard not to look at all of the individual labs and kind of wonder and compare in those support groups. So I would say just try to, let go a little bit of that and partner, but trust the process while you're advocating, but not pay attention to all of those little things because you'll make yourself crazy. So those are two big ones I can think of. And I would say also things, pre-transplant and post-transplant are very different. And it's just like transplant is it's not a cure, but it's a treatment, or I can't remember like the phrase that they say, but it's there's no cure, but like a transplant really gives you this gift of the second chance, and just try to take everything a day at a time because there are bumps in the road along the way too. That's all.
Oh, that's really great, Carly. And I appreciate you taking the time to share with that and be here with us tonight. I'm going to jump to the iPad who has their hand raised really quickly before we continue. So if you want to unmute and ask your question, you are welcome to. Looks like Andrew and Caitlin is who it is. So if you want to unmute and go ahead.
My wife and I are here with our 5.5-month-old and set up the camera stuff.
Oh.
So she was born with an ASD and then the biliary atresia diagnosed at roughly 3 months. And she actually just had labs today. This is kind of a general question for providers and parents and those that have experienced it. Is feel free to chime in. Her labs came back today and everything's trending in the right direction, but the big challenge we have is weight gain. She is 5.5 months old and about 11 pounds, 12 ounces.
And she has an NG.
And she has an NG she's had for a month now. So born, yeah, you can hear her, born about 3 weeks early at a normal weight, 7 pounds, 8 ounces. So we're just kind of at the point of, is this common to not have the weight gain with labs trending in the right direction? Any suggestions for gaining weight? Any and all input is requested.
Would anyone like to give a shot at that? I appreciate you guys being willing to come off and have that conversation with us.
I think it's a little hard for us to be able to make specific recommendations because it is so individual patient specific. And we do really look at those trends over time to see how things are going. I think it's for us, it's a reevaluation process. So it's looking at things, making adjustments, reassessing, and then making a stepwise approach in terms of trying to get to higher calorie goals. So some of the things I talked about with fortification of formulas and things like that, or trying different ways to give feeds, if there's any problems with tolerance. And so those are things, but nutrition and waking can be difficult. And so I would say just, going back to the question of if we have any advice, I would say, my advice is please don't be shy about talking to your team about your concerns and bringing things up repeatedly, because it's important. And sometimes people try their best as providers to explain things and answer questions, but sometimes it just takes a different tack, and maybe we haven't realized that the way we explain something isn't working great. So, oh, hi.
Sorry.
So I would just say, keep talking to your providers and bringing things up and being patient with the process, because I think it is a process.
Yeah, I think the one question I had is, how do you, as a family dealing with biliary atresia, how do you know if you should be advocating to go to TPN? Because we've done 28 calorie formula. We just keep bumping up and it's not working. So I'm wondering, does anyone have any experience with advocating for TPN? Because I know TPN can be hard on the liver as well, from what I read.
We were, first of all, I want to say it's so hard to be in the position that you're in and have like a sick but stable baby. It's so hard to be in that position. It's so confusing. This is just like our individual situation. It was similar. I think they kind of like step ladder everything, and that would probably be like more of a last resort. But again, like you'll ask your team and they'll guide you. But specifically with my daughter, same thing. She got to the point where she just wasn't gaining. She was like losing everything and then also vomiting. But then her labs were still okay. And then at some point things did kind of start to shift. So TPM was disgusting. But prior to that, it was like more calories, continuous feeds. Like there's just more of that step ladder approach that they might take before they would jump to something like that. So even overnight, like using a kangaroo pump instead of doing like bolus feeds, stuff like that.
Okay, thank you. We appreciate it.
Thank you, Dr. Kasper and Carly, for sharing some of your thoughts with them. And we appreciate your braveness for coming off and coming on camera and sharing your sweet baby with us as well. We know it's not easy. Tiffany, because you are next on my screen, I am going to hop over to you if you're okay with that. Just again, sharing a bit or two pieces of advice for maybe parents new on this journey or parents later in this journey that are maybe having a harder time with where they're at right now.
Can't really say anything about for a transplant because Cooper never had the feeding issues like majority of them do. So I don't really have, advice on that or anything.
Just in general for patients, just for maybe parents who are watching this later on and just, not looking for something that maybe someone would have shared with you early on or something that you wish you had known or heard about during you guys' journey and even where you're at right now.
It does get a lot easier. I will say that it does, there's a light at the end of the tunnel that just kind of smooths out. I mean, he has, other issues that we deal with that's not transplant. But transplant wise, it does get easier. I am really bad. Like what Carly said, I get really bad anxiety about like, if something's like off or something, I Google a lot, which you should never do. And then usually, his Dr. Campbell hears from me a lot. So I would say try not to Google and just trust your team, because then it does drive you insane. Like he had a wacky fibro scan result in July. It ended up being just a machine. And then he had his annual beginning of November. And it was completely normal. And I stressed over it for the whole entire time. I kept looking up stuff for like the whole 6 months. Just don't do it. I would say that.
Stay off Google. That's it.
Stay off Google.
Don't
go on Google. I'm really bad at it. But other than that, I think it's easier, if they're off, you think they're like sick or something, or not feeling good, like his pediatrician's great. I can be able to call him, get him in like the same day, real fast. Cincinnati, they're really responsive. They usually get back to me like really fast. So just, reach out if you have a question. they're not going to judge you for it. There's no stupid answer. I guess that's about it.
No, that's great. And I think most of us can agree with the staying off Google aspect, regardless of where you are in your parenting or life journey, because we are all guilty of doing that. Rachel, what about you? What would you share either with parents or maybe other kids who are growing up with BA? And what is something you wish you had known early on and where you're at now, or maybe something your future self needs to hear?
Yeah, definitely. I would say building a support system, a community where we can all come together and talk about our experiences. So I definitely, as Carly said earlier, just that network and community definitely does help out a lot. I actually did not tell anyone about my liver transplant, so I always kept it to myself. And just recently, I would go on the media and I would see kids struggling, and I just knew, oh, I definitely have to do something about this and share my story and my journey, and hopefully, help others.
That's incredible. It's very selfless of you to be willing to open up when that hasn't been part of your story up until later on. And Taylor, that brings me to you. What is something that you would wish someone had told you, or maybe something you wish you had known or had heard, or something you would want others to know?
When we first got Walker's diagnosis, like we knew nothing. Like the surgeon who did his surgery was not a hepatologist, he's a general pediatric surgeon. And he's like, I've done one other one and right now it's working, but that's all we knew. And so you do Google it first, and that is not recommended for the postpartum mind at all. But I wish someone would have been like, this is what it is, and reach out to the groups on Facebook, the people on Instagram. Like I've made so many connections with other parents who have been through this, and like we've talked, like, how is your child at this stage, or vice versa. And like just that community online really helped me mentally get through a lot of it.
Yeah, that's really great advice, especially in today's age. Go ahead, Carly.
One last thing to piggyback on what you just said. That's so true. I think when you can kind of connect with people that you can keep in touch with throughout their journey, because sometimes those groups, people post if they're in a crisis or if there's something wrong or going on. So then you kind of see like the worst of the worst. But when things are great, people don't always post, or don't always share in those types of groups. So just keep that in mind too. But definitely like connecting with people throughout the whole journey, I think has been really helpful.
Yeah, don't be afraid to take a break from that group if you need to, because we've all been there too.
Yeah. And I see there's somebody here from Bayer on the Biliary Atresia Research and Education. That's been another more recent group that's dedicated to this exact type of thing, like parent-to-parent networking and working with all things biliary atresia. So I definitely would recommend connecting with Bayer.
Yes, Bayer is an incredible resource, and we definitely love having them on here with us. I am going to jump to our three providers, and I would love if each of you wouldn't mind sharing something. Dr. Kasper, you are at the top of my screen, so I'm going to start with you, but sort of similar to what I asked them, maybe something that you hear often in clinic, or something that maybe parents are bringing to you frequently where you think, man, I really wish this was more common information, or I wish more parents were hearing this information, or maybe even older pediatrics were hearing something.
A question I get all the time is, how will we know when they need a transplant? And I think that there's very few, so we don't actually have transplant at my center. So I am a hepatologist, trained hepatologist, but we don't actually do transplant here. And so having a family go to another center where they're evaluated, I think there's oftentimes there's a definite point where you get to be listed, but every patient really has a very different journey, and it's very hard to know at any one point when you are going to get to that point where you need a transplant. And so I think I resonate a lot with the feelings of anxiety about how what's going on now and what's going to happen next and things like that. And I think it's super hard to manage those feelings. I would say if it does become overwhelming, then finding support for yourself is really important too, and being able to, if you can, fall back on support systems and even support that may be available within a center for the parent, because the parents also deal with a lot of this, managing everything, organizing everything, watching their child go through this. So I think that would be my one thought.
Yeah, I really appreciate that. And like you mentioned, parents are really walking through this journey alongside of their kids. And even though it's a different aspect, they're really shouldering a really heavy burden as well. So having that access to care and taking care of yourself, or putting your oxygen mask on first, as we hear often, and really being able to emphasize that care. Dr. Taylor, you are next down my row, so I'm going to hop to you.
No, that sounds good. I was gonna kind of, I think, tackle kind of that. We talked a little bit about transition of care. And I think that that's been a really important time. It's a really important time. It's really bittersweet, right? You get to watch children grow up, and then as a physician, and then it's time for them to go and meet other hepatologists and things. But I think that what I like to do, or what I'd like to say, is that we start early so that it doesn't seem overwhelming. It's not all of a sudden you get to 18 and oh my goodness, like the light switch changes and it's going to be going to a different you're going to have a different doctor, or 21, or whenever that transition might happen at your institution. It's a gradual process, much like lots of different things. And it's this, it's an assessment of where is the child or teenager, usually, where are they at in their, responsibility, and, how do we tailor this to them to make this successful, and for their family too. And so we kind of, it's laying in responsibility, laying in things, getting them comfortable sending us messages, calling us, and kind of working through that with them. And, I think that, and in my mind, we transition when a patient is ready, right? Not when, not when it's like, okay, it's time. And so I just kind of walking through that part. And I think that as physicians, we've walked with a lot of families through that different. And there's some tips and tricks we try to do. I try to see kids before college and before they leave home a couple more times, right? So we can get kind of them a little bit more, but there's ways to do it and ways to do it well. And I think it's something to kind of start early conversations and those types of things, but it's not something that should be overwhelming all at once. So.
Thank you, Dr. Taylor. And Dr. B, that brings us down to you as our final voices.
Well, thank you. I always learn a lot from listening to parents and patients, and I certainly have learned a few points tonight. And I think that over the years, what's been clear is we need to be able to set expectations so that the families really know what might be around the corner. Another point that was already brought up, and that is we need to understand what is involved in their world. And I always try to make sure I ask, how are you doing? When you look at the parent in the context of, we're going to depend on you, we need your help. And not just an idle hand waving, how are you doing, but how are you? And to really try to listen to what their limitations are, and how with our resources, and luckily our center, we have a significant amount of resources that can help families, and how we can utilize those.
Thank you, Dr. Balistreri. And I know that before we wrap up, Ivory Allison, who is one of our national senior directors here at the American Liver Foundation, just wanted to speak a few words for all of us.
Yes, thank you so much, Morgan. I just wanted to say a few words. Thank you all for sharing your stories. I'm not quite sure if you truly understand how important and vital this is, because as you all know, so many people don't talk about this, or don't share their story, or are not aware of this. And we currently, on our private Facebook group for pediatric families, we have about 860 members of this group, and we will be sharing this recording, and hopefully it'll be able to help them and help others who are going through this process. So it's so key. So we greatly appreciate it. We also, I always want to tell people, and Morgan kind of mentioned it, you know, taking care of yourself is key. And we currently just launched a BA journal, support journal for parents on our website that you can download to make sure how am I feeling as a mom or as a dad, as we saw, just to make sure you're remembering to take care of yourself so that you can be as close to 100% as you can to take care of your child, to be there, and that's emotionally and physically, and sometimes, you know, and I'm so glad Carly mentioned the Bear. We went to their symposium earlier this year, and there was a mom who stood up and she says, some days it's hard, just emotionally it's difficult, and she said, I had to get to a point where I felt comfortable breaking down, not that I was totally wiped out and that I couldn't get back up again, but just taking that 30 minutes just to break down and cry so that I can go on and move on and continue what needed to be done. Because sometimes it's just a release, just that cry, or, you know, talking to someone and saying, this is a little bit rough today. That doesn't mean, as we've heard from Rachel and all of you, that the full journey is going to be a rough one, right? Sometimes you can just have a little skip, and, you know, but you don't fall, and it looks like none of you have fallen, which is amazing. And I think sharing your stories will allow others to know you're not going to fall. You might skip and trip a little bit, but you're not going to fall. And so I just wanted to share that information with you guys, and just thank you for sharing your stories with so many people and having this community to be able to talk. We listened to Rachel talking about 1995 and probably her parents were like, well, what is happening? Couldn't find any information. She's talking about beepers. And so we've definitely come a long way from that, and a long way from 8 years ago. And hopefully we'll be able to, as Dr. B says, in 30, 50 more years, be able to be totally in a different place from then. So I just wanted to put that out there and make sure let Morgan have the final words to close us out this evening.
Well, I think Ivory wraps this up beautifully. Like Ivory had mentioned, none of you have fallen, and that is such a great just metaphor for what your journey is. There are these bumps along the way that maybe you have to hop over or skip over, but you still are on your feet, even if there is a fall. You guys are still here, and we just really do appreciate you taking time this evening to share your stories and really be open and honest and really just raw with everybody about how this isn't a linear journey. This isn't the same story that Carly shares or Taylor shares. Everyone has their own unique journey. And we're so grateful for Dr. Kasper and Dr. Taylor and Dr. Balistreri for being with us as well this evening, and just showing your support for these other BA families that we know that you guys get to see some of them once in a while, but we are just grateful that you guys are willing to be open and share and listen to what some of the parents are saying as well. So we are just grateful for everyone. If you have any questions, we are happy to send links to you all that are in the chat. If you would like those later, please just let me know. And we will, like Ivory mentioned, we will be sharing this in our Facebook group, and I will also share the links in there as well. So if anyone has any questions, please feel free to reach out there. But I appreciate you all being here this evening, and I hope you have a great night.
Thank you.
Thank you.
Thank you.
Bye.
Thank you.